Hi, I'm Amber Hussein. I'm a third-year surgical resident at Guthrie Robert Packer Hospital. General surgery was the only thing I could see myself doing for the rest of my life. It's the only specialty where you felt like you had a direct, tangible reward when it came to patient care and outcomes. So you had an immediate, direct effect on someone's life.
Hi, my name is Anto. I'm a third-year surgical resident at Robert Packer Hospital. We take the medical healthcare for granted here, and I realized that outside there's a lot of people who need help, especially surgical help, and that's when I decided surgery was the one. And also, I figure when I'm 60 years old and look back in my life, what kind of career will I have that make me not regret my life? And surgery was it.
For residency programs, I was looking for number 1, location in the Northeast area. Number 2, the size of the program. I wasn't looking for a program that was too big or too small, so this seemed perfect. And then number 3 was an appropriate balance between educational curriculum and clinical activities and responsibilities.
One of the things that I kind of surprised about Guthrie actually is the number of people who go into fellowships, and the fact that even though we are a small community programs, a lot of the residents who have graduated before me actually managed to get into fellowships.
It's amazing. I'm surprised every day about the amount of surgical pathology that we're actually exposed to and the wide variety of cases that we actually get here in Sayre, Pennsylvania. You'd think that we're actually in a giant center somewhere in a city, but it's very good.
So there's actually a lot of things to like about the programs. The little things that I like is the fact they have your own cubicle, so you can decorate however you want. We also have a couple residents who are into decorations, who would actually decorate the whole resident area. So we have spring, fall, Valentine, all of that stuff. It's just the spirit, like you actually have a life outside of surgery. And then the big things I like about this is the people. The people are fantastic. All our faculties, our assistant staff, anyone from the attending we work with to the nurse aides, they're all very supportive.
So I think a very important person to me in this program has been our program director, Dr. Cager. He is every resident's advocate each and every single day. He's extremely motivating, and he is certainly invests his time in our time and residency and making sure we have the appropriate education and that we get the best out of every day.
What surprised me about this program is we have something called Super Team for Christmas. And what that means is half of the group get Christmas off, the other half has New Year off. And that was really nice to have the time to be actually able to go home and spend with your family.
Guthrie is a good place to grow, both as an incoming intern and learning surgery, and in the future, if you want to continue to stay here and practice as an attending, I think that's something that's also good to know.
Guthrie loyalty. It's a small community hospital. Well, by small, it's very relative, but I've talked to patients who would have all their appointments scheduled in the same day just so they can drive 2 to 3 hours to Guthrie to actually see all the specialists and all their primary care all at the same time. And they're like 20, 30 years patients who have followed with Guthrie very consistently. And not just the patients who are loyal, there's also attending as well. We have one of our favorite attending who actually been here 22 years. And we have a couple other who have been even longer. So there's something right is going on to kind of promote the kind of loyalty, this kind of satisfaction and long-term following.